Hello everyone, I'm Ma Jiangwei from the Department of Respirology and Critical Medicine, the first hospital of China Medical University. This class will mainly discuss pneumonia. First, what's pneumonia? Who gets pneumonia? Pneumonia is an acute infection of the pulmonary parenchyma. It can be caused by bacteria, viruses, fungi, and parasites. Typically, pneumonia is classified as CAP, HCAP, HAP, and VAP in terms of the settings where pneumonia occurred. CAP is acquired in community. HCAP is healthcare-associated pneumonia, occurred in long-term or extended care facility, hemodialysis, outpatient chemo, wound care, etc. Hospital-acquired pneumonia is occurring typically more than or equal to 48 hours after hospital admission. Ventilator-associated pneumonia is occurring in ventilated patients, typically more than or equal to 48 hours after endotracheal intubation. Compared with CAP, HAP and VAP is more severe, has increased morbidity and mortality, and more MDR pathogens. This class will focus on the CAP. Let's start with a case. A 68-year-old male presented to the emergency department with short of breath and productive cough for 2 days. He reports poor oral intake since onset due to the nausea and intermittent vomiting. The patient is requesting to go home with antibiotic. He previously had tongue swelling and skin rash with use of augmentin. He reports good health, otherwise he hasn't seen his primary care physician for past 5 years. He denies chest pain, swelling of extremities, or diarrhea. His vital signs show increased temperature, slightly declined saturation of pulse oxygen. The patient is alert and oriented. Crackles were heard over left lower lung field. The labs showed increased white blood cell and blood urea nitrogen. The chest X-ray had consolidation in left lower lobe. So, what's the best way to further manage this patient? A. Send home with oral azithromycin. B. Send home with oral levofloxacin. C. Admit to medicine floor with intravenous levofloxacin. D. Admit to medicine floor with intravenous ceftriaxone and oral azithromycin. E. Admit to ICU with intravenous ceftriaxone and intravenous azithromycin. Now, maybe you are confused. After this class, you will get the answer. So, the objectives of this class include the definition of CAP, why do we care about it, the diagnosis and management of the CAP, and identify risk factors for resistant organisms and less common causes of pneumonia. The CAP is defined as an acute infection of the pulmonary parenchyma in a patient who has acquired the infection in the community and hasn't had recent hospitalization or association with other healthcare facilities, such as nursing homes, dialysis centers, and outpatient clinics. CAP, why do we care about it? It's very common. There are 5 million cases per year in the United States, and at least 1 million hospitalizations and more than 55,000 deaths per year. CAP is the ninth leading cause of infectious deaths in the United States. the 30-day mortality for hospitalized patients is up to 23%, and it costs $17 billion per year in the United States. And who gets pneumonia? Actually, everyone can get pneumonia, but it's much commoner in the very young and elderly populations. In these populations, the immune system might not be strong enough to fight it. The other risk factors include smokers, alcoholics, or cirrhosis. Chronic excessive alcohol consumption can impair the alveolar macrophage immune capacity, and as a consequence, these individuals are at a significantly increased risk of pneumonia. Influenza and all other viruses infection can damage the mucociliary system or the airway. This can predispose the patient to secondary bacterial infections. Chronic disease are also major risk factors for CAP. Pre-existing lung disease such as chronic bronchitis, the COPD, bronchiectasis, or cystic fibrosis. Neurological disease such as stroke, seizures, dementia decrease the level of consciousness. This can predispose the patient to aspiration of stomach contents and the upper airway secretions. Patients with uncontrolled comorbidities like renal or cardiac disease are also vulnerable to attack pneumonia. This box shows the details of the risk factors. You can see it later class. That's all of this section. Thank you.